New data suggests the Pfizer vaccine may be less effective at preventing COVID-19 infections from the Delta variant. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Now, these new numbers from Israel are preliminary, but they show the Pfizer vaccine is only 64% effective at stopping the Delta variant in the real world. Now, what could that mean for Massachusetts, and do you think we may see more outbreaks and more people in the hospital?
That's right, Shana. So I think what it's saying is that this Delta variant can evade some of our immunity, including some of these great vaccines. But here's the good news. Even though we may see an increase in cases, and we are seeing a small increase from this Delta variant, but what we're not seeing is a significant increase in hospitalizations. And in the study you just mentioned, it was still, the vaccine was 94% effective at preventing hospitalizations. And that's a key number. You know, once you keep a person out of the hospital, you know, you're not going to have the severe side effects from that. So it's one thing to have the virus in the back of our nose. We may be able to transmit it. But ultimately, if we can keep our people out of the hospitals, we're going to do well.
So, Dr. T, that leads to the next question. Two questions, actually. Number one, is 64% still a good number?
You know, I think 64% is a good number. Of course, when you compare it to the initial phase 3 trial where it was 94, 95%, it seems less. But again, I don't want to focus on that number. I want to focus on the still greater than 90% reduction in hospitalizations, 99% reductions in deaths. That's really the key number.
So correct me if I'm wrong. Here's question two that I had off of that. If the Pfizer is an mRNA creation, and for lack of I'm simplifying the word, Moderna is roughly the same thing. So wouldn't it be a similar study result, or no? Is that not a fair conclusion?
You know, it's a likely educated guess at. I think you're right. I mean, the data that we're seeing with Pfizer and Moderna are very similar, more similar than different. And remember, even the 64% reduction in infection, that's still better than the average flu season. These vaccines are just more immunogenic, meaning it gives us a more robust immune response than the influenza vaccines do. So I still think there's no question for those unvaccinated. You have to go out there, roll up your sleeve, and get vaccinated. It's the best way to achieve independence from this virus.
It's good to keep hearing that. And also this week, we learned more than 99% of Americans who died from COVID-19 in June were not vaccinated. Now, as someone who treats these patients, what's your reaction to this?
Right, and despite the fact that we're doing so much better, I'm still making rounds in our intensive care unit seeing our COVID patients. So this is still very real. Let me give you just a perspective of what that number means. We have about 10 to 15,000 people right now dying of COVID in the United States each month. If you have a 99% reduction, that means that basically 9,900 out of 10,000 that are dying are unvaccinated. 100 out of those 10,000 deaths from COVID are vaccinated. That is such a stark difference. If that's not a reason to go out and get vaccinated, I don't know what is.
I'm going to ask you this question, but I already know what your answer is, but I'm going to ask it anyway, because some of our viewers have been asking us that they're really worried about family members who simply refuse to get vaccinated. So what is your best advice?
You know, it's what we have to do is continue to listen to those people that we care about who are unvaccinated and ask them questions, you know, why not yet? And just kind of try to be as non-judgmental as possible and work with them, because hopefully if they haven't been vaccinated yet, obviously it's not too late, and we're still seeing, you know, millions of people still getting vaccinated. Now it's taking months for that to happen. But I just think we have to listen to the people that we care about and ask them and try to give them the sound data. But it is tough when you love someone and you know that they're not vaccinated right now.
Dr. T, it's great to see you. Thank you for your advice.
Take care, Eddie. Bye, Shannon.
All right, thank you.